Simon Topping from the Wellbeing Centre at Brent is going to talk about their digital solutions for registration, booking, activities and attendance. Over to you, Simon. Thank you.
Thank you. So next slide, please. So I'm Simon Topping. I'm an operational manager in the Early Help Service, London Borough of Brent. And we're really kind of tight on time today. So I'm going to try and be really concise with the kind of the key messages. So next slide, please. So Brent started its Family Hub journey way back in 2019, following a wide range of community research and engagement with local residents and stakeholders through outcome-based reviews. It was recommended to have more hub-based service delivery in local communities to enable holistic support to address the needs of the whole family using a multi-agency partnership approach. The Family Hub approach had already been established by many other councils, and with others developing similar models at different stages of development at that time. It was also a need, sadly, to make further efficiency savings. And I kind of, just to make that clear, so this wasn't the case where we had lots of money to develop family hubs. We lost half of our funding approximately for children's centres, and it was a cost-saving measure. So we transformed 9 of 17 children's centres into 8 family wellbeing centres. We're calling them family wellbeing centres, not hubs. And those launched in the beginning of January 2021. The remaining children's centres were repurposed, but continue to offer some support services for families linked to the family wellbeing centres. Next slide, please. So what was the kind of the rationale for developing our digital tools? So the children's centre registration process was paper-based, and once completed required inputting into the eStart database. For context, we use the eStart database for our children's centres to capture and store data. Families were required to either phone or drop into the centre to book onto activities or services. And when families arrived at the centre, they were then required to sign into the building and then to register or sign the attendance sheet for the activity that they were accessing. This information then needed to be input into the eStart database system. So all this required lots of kind of business administration, time and resource. So in a reduction in our funding, approximately half meant that we were going to be reducing staffing levels, particularly those involved with kind of business administration support, which input all the information into eStart. So we wanted to create a more efficient process that was more cost effective and modernized and move away from kind of paper-based processes. What we found as well was that the information that reported from our eStart children's centre period was often out of date because of the line between the activity taking place and data entry. And this was further impacted by staff going off on holiday and having sickness. And sometimes there was inaccuracy in the way staff recorded information onto the eStart database. We were under a huge amount of pressure, like we all are, to evidence the work of our family hubs and centres. And we wanted to ensure that we continue to access resources and ensure their ongoing sustainability. Also, different departments within the council have their own login requirements to access different services, such as parking, council tax and housing. So the corporate team wanted a one council approach where residents had a single login to be able to access lots of different services from the council instead of separate logins. So there were many kind of risks involved in developing a new solution. If it would be ready in time for the launch of the centres, would it be within budget? We were relying on a lot of expertise from our digital transformation team, and from previous experience, these types of projects don't always go as planned. Next slide, please. So we're calling our digital tools the digital solution, and there's 3 parts to the digital solution. The first part being a digital registration process. So residents sign up for a Brent My account. And this is the one council approach for residents and families to access services from the council. So once that's set up, in terms of the kind of the benefits, it gives us real-time data with numbers of registrations by children and adults. We can confirm if a family is registered with a GP, dentist, or school. It enables analysis by different demographics to ensure we're getting access, the right families are accessing the right services in the right centres. And we can promote new services and activities via email or text functions as well. So the second part is a digital booking system where families can book onto activities online. The activities are agreed termly in advance and then published. The benefits of this, it gives us real-time data analysis by number of activities, the types of activities, and those attending activities, etc. It enables analysis of the data by different demographics. Families receive a text reminder the day before the activity is due to take place. And this has helped to reduce families that don't show up for activities or appointments. And families in particular areas can be targeted with specific information. So we can be really kind of local in terms of what we're kind of signposting families to. And then the third part is the digital signing in process. So families, when they arrive at the centre, they're asked to sign in using a tablet or kiosk. And this then registers them for the activity that they're accessing as well. The benefits of this is real-time attendance and usage data is captured. Families can use the kiosk to book onto other activities, or they can change bookings and so on from the kiosks. The kiosks are used to sign in professionals coming into the centres to deliver activities. And just to kind of point out that families can register and book activities using a computer, a laptop, or a smartphone. So it's a web-based platform. Next slide, please. So how did it go? There were lots of challenges, and really within 8 minutes, I don't have time to talk about them all today. But I guess some of the kind of the key challenges were around the timescale to develop and implement the digital solution were much longer than we anticipated, and it had to be completed eventually in phases. The costs were much higher than originally budgeted for, and contingency funding was required. It was a really complex project, and we were heavily reliant on our digital transformation team to interpret and translate into tech speak what we kind of wanted to do, and then liaise with developers, software developers in another country. Trying to convert paper processes into digital processes is a much more complex task than you might think. So we had flow charts coming out of our ears and to map the kind of the workflow, and there were lots of kind of exceptions to the rules that had to be considered and factored in as well. And actually changing the behavior of service users, and particularly staff, was more challenging than we anticipated. To begin with, staff hated the new processes, and dealing with all the change management stuff from doing things in a different way took a lot kind of longer and was harder work than we anticipated it being. So initially there was some negative feedback from parents because it was a new way of doing things. And I think we just have to appreciate, though, that change can be difficult for people at all levels. Consideration needed to be given to families impacted by digital poverty. And one of the speakers kind of touched on that earlier. Some of the most vulnerable families could be excluded because of the digital process through a lack of device or data or know-how. We also had to think about language barriers in Brent because we're one of the most diverse boroughs nationally and in London. And data reporting systems at that time were not accurate, and we just had to accept this. And the pandemic added also additional kind of unforeseen risks that we hadn't anticipated at that time. But in terms of successes, the digital solution launched, hooray, in 2021. So we have new families registering all the time.
And less than a minute, Simon. Sorry to interrupt. Just
okay, I'm nearly finished. New families registering have been really positive. To date, we've had about 8,000 individuals registered, and there were approximately 50,000 recorded contacts with families over a 6-month period. The new Family Wellbeing Centre delivery model was implemented with less staff in business support, and the digital solution is coping well with all the changes. A priority for the council is supporting residents with digital inclusion. So just to kind of emphasise that this isn't the only way of doing things for families. They can still phone up, they can still show up at the centre, and they'll be very much supported with registration and booking. They don't need to be able to do it just solely through a laptop or a phone or whatever. New reporting systems were created which provide more flexibility to analyse data in different ways. And you know, with lockdown, we've all been there. We've had to adapt to new working practices, and actually it allowed us more time to kind of pilot the digital solution in phases and make adjustments in an agile way as we kind of went along. And it's not a finished product by any means. We're continuing to do kind of tweaks and adjustments here and there to make it more fit for purpose. I think those are the key messages, but thank you.